Let me read a non-text from New York Times and try to show you how quickly I can understand anything. This is my first time to read anything. Let me show you how quickly I can actually cross up the fact. I really don't mind. So it's easy. The ICE agents, they are actually, posing a very challenging question to parents at this moment. Whether they want to actually stay together with their kids while in detention, or they wanted to actually let go of their children to experience a separation for the sake of their children's health. These type of questions are very, very troublesome. Think about it. In the time of a pandemic crisis, would you like to let go of your kids? Would you like to get your kids released? That means you have to undertake the separation from your children up until a non-period. That's really a troublesome question. The ICE, the Immigration and the Customs Execution Implementation Center, this is a very challenging notification. Those people who actually demand the absolute commitment to keep the hygienic conditions, they are forcing parents to make very choices. It's really like Hobson's choice. Both of them are very difficult and tough to accept. So, many of immigration officers, as well as the ACU, American Civil Liberties attorneys, who've been working closely with immigration lawyers, they were very, very horrified to meet this situation because many parents are already emotionally agonized. They themselves are in detention right now with no proper access to minimum human rights. That's really the case. They do not really have a victuals to properly nourish their children, no disinfectants, because inside the detention center, you cannot actually guarantee social distancing. So if you ever actually want me to read a little bit more complicated, then I would be happy to do it. This is a little bit easier, right? I'm not lying, I never actually repeated. So far, Donald Trump has been #1 advocate for selling, or at least fast-tracking and shipping arms to Saudi Arabia. Despite the Saudi Arabians' growing totalitarianism and authoritarianism under the leadership of Mohammed al-Salman, MBS is really the person who has been constantly suppressing his own people. Even after the death of a journalist named Jamal Khashoggi, this was really the case. Donald Trump already actually claimed that this type of immediate transaction to sell off more of arms and weapons to Saudi Arabia would create starting from 500,000 to even 1 million jobs. these would be a job creator by constantly operating those, planes and factories devoted to creating and inventing arms, weapons that might be chased after by the Saudi Arabian kingdom. That's what has been said. But however, this would likely to be almost multiplied, or almost 10 times greater than what would normally be, according to the recent investigation even conducted by the Inspector General, who was just simply removed last Friday by President Donald Trump. Stephen Linick was really working on it, and according to this research, the actual jobs that were created would be merely 20,000 to 40,000. So even this massive, delivery of weapons, the actual consequential benefits that would be created by this would be so minimal. That's what has been already unearthed by this very raveling investigation led by Inspector General Steve Linick. In the first place, this was already a betrayal against democratic values the United States was standing up for, because it already actually slapped off the Jamal Khashoggi's dismembered body. There was no proper inquiry into this type of murderous behavior conducted by the MBS, who was trying to consolidate his power grip on the regime. That's what has been mentioned. It's very troublesome. The actual consequential events in the first place promised by Donald Trump would be almost laughable to be met with the real consequences. Several billion worth of weapons delivery to Saudi Arabia through the contractual agreement should in the first place be banned because of the growing authoritarianism. However, the promised premises, those already promised consequences and premises that were there, were now truly indeed laughable. So in the first place, what Donald Trump promised as a very auspicious and a promising dreams, that could have just actually easily come to fruition if and only if continued this transaction with the Saudi Arabia. Now, once we actually open up this box, and when we actually get to the bottom, the actual numbers and digits are very dismal. Think about it. In the first place, this promise, it would actually create at least 500,000 jobs. He already promised that. It sounds really like the very promising premises, right? But you can actually say that. What I want to say is, if someone actually promises something, promised a deal, that was a foregone. It's a really different meaning. Promised a deal that has already orally mentioned something promising, that's auspicious. Vielversprechende. Auf Deutsch, das heißt vielversprechende. But it's really the case. So if you ever actually remember Jamal Khashoggi's case, there was a very dedicated New York Times journalist, technically a Saudi Arabian journalist working closely with the New York Times. He was dismembered. His body was not still found inside the embassy in Istanbul, which was really the Saudi Arabian embassy. Ever since he actually had gone into that office, his disappearance was consolidated because his whereabouts after that point still remained unknown, right? I don't really need to think about it. It's very easy. Never actually had anything missed. It's really great. No, I'm not lying. Ha 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 ha. It's very interesting. Donald Trump still refused to wear a mask, even during his visit to one of a ventilator's producer in Michigan. He actually, puts down his decline because he considers himself a symbol of masculinity. Because he really actually puts a greater emphasis on those type of behaviors that would appreciate the masculinity, the voices and height and firm hand grips or anything. He has a certain type of consideration that wearing a mask would be somewhat unprecedented, or at least, there would not be a proper estimation of qualities he really liked to cherish. That's really the reason. So that's really Donald Trump's visit to local plant in Ronspin, Michigan, which is really nation's #1 ventilators creators right now. But even the state's, Democratic governor, including the plant's, factory manager, surely try to convince him. You should wear this. You should wear a mask. Donald Trump in this picture is holding a face shield as a symbolic act to demonstrate the face shield would be necessary. But it's really interesting right now because the Donald Trump administration right now publishes an estimation that minimizes the possible deaths from this point. But this should be met with a grave consequence if these underlying premises are not going to be met. What is that? Everyone should wear masks or face cover-ups or whatever type of protection gear. Otherwise, this would go multiplied, out of control. It's a very, very riveting if you ever actually understand the intriguing situation. Donald Trump is really the very culprit who's been violating the orders given by the public health advisors, but he's been actually projecting a number that would be fixated on this fundamental premise. What is that? Everyone should be masked up. Everyone should wear masks. In this way, we can actually minimize any possible deaths from this point, which would be very pivotal to open up American business once more. But he is really the one who's been definitely saying, no, I won't wear it. Because even on the plane to site, the president was constantly being asked to wear a mask, even by a Democratic governor from the state of Michigan or the factory manager, for the sake of the security of those workers on the floor. That's really interesting. He's been actually, taking a tour to look around those, facilities in the region. And that was fantabulous because, he in the first place demanded more of automakers to work really hard on creating ventilators, which would definitely screen and filter the quality of air. That's what has been said. It's very interesting. Contrary to the previous acknowledgement by the CDC, right now its agency has a new statement saying that the virus does not spread easily from surfaces to surfaces or from animals to human beings. At least you don't really need to worry that much about the situation. If you are worried about the possible contamination and infection coming from touching the surfaces already tainted with a virus or sharing with other people, you can actually, at least keep it at bay. You can at least, put a little thought into it. That's according to the latest guideline published by the Centers for Disease Control and Prevention. It's really interesting because at the very beginning, the surfaces could actually, at least maintain the virus propagation up to 24 hours. That was really the reason where people were desperate to use a disinfectant like Lysol to wipe off and clean off, any type of contact infection. I mean, if you ever actually wipe up the surface, then you can minimize the propagation of a virus, that would be generated by the contact, right? That's really interesting. This is really the latest version. I'm not really so sure. Maybe the CDC was under influence of the Donald Trump administration, who's been simply putting politics over science. It's up to your decision. You might actually really need to take any type of latest information coming from the CDC or FDA with a pinch or a grain of salt. Who knows, right? Hmm. So many of the scientists at this moment warn that possibly the CDC could have already mixed the two different testing results to at least, diffuse a very confusing and confounding data result. The CDC's the Center for Disease Control and Prevention has already acknowledged that there could be a possibility of mixing two different results that might actually be accumulated and gathered and collected from different types of results. Number one, the first test database is normally called the PCR, polymerase test. This should actually be the very active infections, and the PCR test would normally get the digits from the actively infected, those people who are affected by the coronavirus, by being on the front lines. Those people who are grappling with the coronavirus as of now, or they had a very relevant history within a couple of months or a few days. At least they have a very burning traces left behind, which can be easily identified. However, the serology test is a really different idea. This is really about unraveling the antibodies in one's patients to actually have a full grip of the pathological and epistemological history in backward. It's more like backward tracing. Serology tests, you can simply say that, it's a backward tracing to actually count the antibodies that would already actually built up its own colony inside the body after the history of a pathology. So if you actually suffered from the coronavirus, then you could probably have developed antibodies. By tracing down the antibodies, that you can actually easily deduct the fact that this person was at some point was indeed diagnosed with the coronavirus. That's what you can actually extract as a deduction, right? You can actually derive a fact that this person was once upon a time, what was indeed diagnosed with the coronavirus. That's what has been said. But the problem is the serology test is not really something that could give a very exact and accurate picture, because it's not up to date. It's not down to switch. It would take a couple of months to at least have a full understanding. And then the antibody tests are very much difficult to be configured and realized with exactitude. For that reason, it would be slightly dangerous. Simply actually, gathering the information based upon the model of the serology to have an idea how many people are infected, then this would be very much retarded. That's the reason why, especially the scientists involving who are, involving the scientific inquiries are very much concerned, especially Jennifer Nuzzo, who is at Johns Hopkins University already makes this type of a pivotal pitch, saying that these two numbers should never be mixed together, because if this type of authoritative agency wants to jump into the accurate number to have a very clarified vision and a picture for the disease control, the serology tests should be separated to keep track of the people who might actually develop the antibodies in their body after their fight against coronavirus personally. And these should never have immediate influence to change the picture of the infections. The activated vivacious infections should be calculated differently. This should never be a part of a tally. Yeah, if you want to actually tally up the very burning numbers that are directly affecting the population with the coronavirus in their body at this moment, as of now, then they should at least segregate those two different species to conduct a different and classified testing method. That's what has been said. Because it's very, very tough to at least segregate or separate those two numbers. However, if you really wanted to have a very accurate viewpoint to measure up or tally up how many people in our society are right now under the influence of a coronavirus as either being infected or either being plagued by the COVID-19, then you need to put your focal point on the polymerase PCR test. PCR test would be much accurate and lively and up-to-date version to have at least a very full grip on the people under control and influence of the coronavirus. Serology tests would be more like retrospective and backward-looking agenda. This would be helpful to develop the vaccination, but simply to have a full grip on number of people with the coronavirus as of now, that's not really that helpful. But CDC at least has admitted to a certain portion this type of mixture between two different test results, which should have been segregated and sequestered and separated immediately from one another. Unfortunate. Why is it so important? Why do we need to have a very accurate number? Because this type of PCR test can only picture the precise number needed for the lift up on restrictions on social distancing or travel ban. If we ever actually wish to go back to normalcy, we need to actually tally up the number of people with the coronavirus with a crystal clear accuracy and precision. This would be the very fundamental condition that should never be breached. If you ever wants to push people to go back to work, then how can we actually predict how many more people would or might die from coronavirus and COVID-19 if we cannot actually at least tally up and calculate how many people are right now with the coronavirus with no symptom or symptoms? How can we actually be much accurate? But serology tests should never be part of the system. At least to tally up, measure up, count up the people out there with the burning virus in their body. That's really the issue.